How do inflammation markers and blood tests affect stroke severity? Imagine your body as a bustling city, where the immune system acts like the city's emergency response team. When a stroke happens, it's like a sudden disaster that triggers this team to respond. Blood tests can reveal signs of this response by measuring inflammation markers, which are like signals indicating how intense the emergency is. These markers are crucial because they help doctors understand how severe the stroke might be and what kind of treatment could be most effective. In the case of stroke, blood flow to parts of the brain is blocked or reduced, leading to brain tissue damage. The body's natural response involves activating the immune system, which releases molecules called inflammatory markers. These molecules can sometimes make the injury worse by increasing swelling and tissue damage. For example, one key marker is interleukin-6, a protein that promotes inflammation. Higher levels of interleukin-6 are often linked to larger areas of brain damage and poorer recovery chances. Another important marker is the neutrophil lymphocyte ratio, which compares to types of white blood cells involved in inflammation. When this ratio is high, it suggests a strong inflammatory response, often associated with more severe strokes. C-reactive protein is another blood marker that rises when the body is inflamed. Elevated C-reactive protein levels have been connected to worse outcomes after a stroke, indicating more extensive tissue injury. Besides these, other markers like the systemic immune inflammation index, platelet lymphocyte ratio, and neutrophil hemoglobin ratio are also being studied for their potential to predict how severe a stroke might be and how well a patient might recover. These markers are not used alone but combined with clinical assessments to give a clearer picture of the patient's condition. Measuring these inflammatory markers in blood tests helps doctors predict the likely course of the stroke. If inflammation levels are high, it might mean the stroke is more severe, and the patient could need more intensive care. Knowing this early can help in planning treatments that target inflammation, potentially reducing brain damage. It can also guide decisions about rehabilitation and recovery strategies. Monitoring inflammation over time can show how well a patient is responding to treatment. If inflammation decreases, it might indicate that the brain is healing and that interventions are working. Conversely, persistent high levels could signal the need for additional therapies. In summary, inflammation markers in blood tests are valuable tools that provide insights into how severe a stroke might be and what the prognosis could look like. They help healthcare providers make more informed decisions, personalize treatment plans, and improve patient outcomes. However, it's important to remember that each person's response varies, and these markers are just one part of the overall assessment. Always consult with healthcare professionals for a comprehensive evaluation and tailored care plan.